Hello everyone, and welcome back to the channel. To understand why these treatments are such a breakthrough, let's first talk about what really happens inside the body. The prostate is a walnut-sized gland located just below the bladder, and its main role is to produce fluid that nourishes and transports sperm. As men age, this gland tends to grow. By the time a man reaches 60, about half of men will experience symptoms of BPH, and by age 80 the number rises to nearly 90%. This growth is not cancer, but because the prostate surrounds the urethra, any increase in size squeezes the urinary passage and creates the cascade of symptoms we just described. Traditional medicine tried to control it with drugs such as alpha blockers and 5-alpha reductase inhibitors, but these only relieve symptoms and do not cure the problem. Worse, many men stop taking them because of dizziness, headaches, and sexual side effects. Then came the classic surgery called TURP, or transurethral resection of the prostate, which literally scrapes away part of the prostate through the urethra. Effective, yes, but invasive, painful, and with a high risk of permanent complications. This led researchers to ask a very simple question: can we shrink or open the prostate without cutting, burning, or removing tissue in such a brutal way? The answer today is yes, and the new treatments are almost unbelievable in how simple and elegant they are compared to surgery. One of the most popular options is resin water vapor therapy. In this procedure, a tiny device is inserted through the urethra, and bursts of sterile steam are released directly into the prostate tissue. The steam penetrates the cells, destroys the excess tissue, and over the following weeks the body naturally absorbs it. The whole thing takes 15 minutes, requires no incisions, and is often done right in a doctor's office. Men usually go home the same day and keep their sexual function intact, with relief that can last for years. Another innovative treatment is called urolift, sometimes described as the prostate lift. Imagine your prostate squeezing the urethra like a clamp. The urolift system places tiny permanent implants that act like curtain tiebacks, pulling the sides of the prostate back and leaving the urinary channel open. There is no cutting, no heating, no destruction of tissue. It is minimally invasive, provides immediate improvement, and recovery is extremely fast. Then we have the ITIND device, a temporary stent made of a special alloy. Doctors place it in the urethra for about a week. While it is there, it gently reshapes the tissue of the prostate, creating wider channels for urine to flow. After a few days the device is removed, but the reshaping remains, providing lasting relief without permanent implants. Men appreciate that it is temporary, reversible, and yet highly effective. Another futuristic option is aquablation therapy, which uses a robot-controlled water jet to literally sculpt away excess prostate tissue with pinpoint accuracy. Unlike traditional surgery, aquablation uses no heat, meaning there is less risk of damaging nerves responsible for sexual function. Guided by real-time ultrasound, the robotic system ensures that only the problematic tissue is removed while critical structures are preserved. Studies show that men who undergo aquablation maintain sexual function at much higher rates compared to traditional surgeries, and the precision is remarkable. Finally, there is prostatic artery embolization, or PAE. This procedure is performed by an interventional radiologist, not a urologist. A tiny catheter is threaded into the arteries that supply blood to the prostate, and microscopic particles are injected to block the blood flow. Over time, the prostate shrinks naturally because it is no longer receiving as much blood. This is done under local anesthesia, without ever touching the prostate itself. Patients usually walk out the same day, and the risk of sexual complications is minimal. What makes all these treatments revolutionary is the fact that they preserve quality of life. For decades men had to choose between living with symptoms, taking pills forever, or risking their sexual health and continence with surgery. Now, men can choose procedures that are minimally invasive, effective, and safe. Many of these treatments can be done in less than an hour, in outpatient settings, with only mild discomfort, and recovery is a matter of days, not weeks. Clinical trials have proven their effectiveness. Resum shows durable results up to 4 years, Urolift maintains relief with long-term satisfaction, ITIND is gaining traction in Europe and the US is a simple yet powerful option, Aquablation is making headlines as the robotic precision future of urology, and PAE is being adopted by major hospitals around the world. This matters because millions of men suffer in silence. They think constant bathroom trips at night are normal, that straining to urinate is just part of aging, or that sexual side effects from drugs are unavoidable. But that is no longer true. We are living in a new era where enlarged prostate does not automatically mean medication for life or invasive surgery. We now have alternatives that restore comfort, preserve dignity, and keep intimacy intact. If you are wondering whether you qualify for one of these treatments, the answer depends on the size of your prostate, the severity of your symptoms, your overall health, and the availability of these options in your area. Generally speaking, men with mild to moderate symptoms can benefit from Resum, Urolift, or ITIND, while men with larger prostates might find Aquablation or PAE more suitable. That decision should be made in consultation with a urologist who is familiar with these new techniques. But here is the most important point: do not ignore your symptoms and do not settle for outdated solutions. If you or someone you love is waking up 3, 4, or 5 times a night to urinate, if you feel embarrassed in public because you constantly search for the nearest restroom, if your intimate life is suffering because of medications, then it is time to talk to your doctor about these groundbreaking treatments. Prostate problems are not something to be ashamed of, and knowledge is power. The shocking new truth is that surgery is no longer the only way forward. You deserve to know your options, and you deserve to live free from the burden of BPH. So if this video helped you, please give it a thumbs up so more men can discover it, subscribe to the channel for more science-backed health insights, and share this with a friend or family member who might be silently struggling. Remember, your health matters, your quality of life matters, and the future of prostate care is already here. Thank you so much for watching, and I will see you in the next video.